Good afternoon. I'm Judy Chan, and welcome to the second webcast in our series, Virtual is the New Reality. Today, we're going to talk about what does the patient really want? So let's start with what we're defining as virtual healthcare. Virtual health is healthcare services that are technology enabled and provided independent of time or location. With virtual health, consumers can access a full range of health services to remain healthy, get a diagnosis, treat an illness or injury, or manage an ongoing condition. So the range of technologies includes video, mobile apps, secure email and messaging, social platforms, sensors, and more. To answer the question, what do patients really want? I have two answers for you today, and we'll go over both. One has to do with the basic expectations of the consumer, and the second is the in-depth expectations of the consumer. It depends on how much you care about giving your customers and patients a good experience. So there are 9 basic expectations of the consumer. Number 1, don't hurt me. 250,000 people die every year because of medical mistakes. It is the third cause of death after heart disease and cancer. So I expect you, and I trust you, not to harm me accidentally or otherwise. Number 2, listen to me. Ask me your questions and I will answer your questions, but I will also tell you what's bothering me. And please take my pain seriously. Number 3, communicate clearly in a way that I can understand you. One example of this, of course, are multiple languages that people speak. But it's not just language, it's also a cultural understanding. At the same time, you need to be wary of personal biases that can creep in when looking at and evaluating patients. To give you an example, my father was in generally good health, but at the age of 99, he occasionally had to go in the hospital overnight. So the doctors, the hospitalists, would look at his chart, they would see his age, they would see that his race is Chinese, and they immediately made assumptions. They assumed that he would not be able to understand them because he would not understand English. Now, my father was born and raised in Oakland, California, and English was his first language, and he served in the military for World War II. So still, these doctors, these hospitalists didn't bother to ask the question. So when I was there visiting my father and the doctor would come by on rounds, we'd introduce ourselves and they'd ask me, they'd look at my father and they'd say, can you ask your father if he's having any pain today? So I looked at my father, who's looking at me, and I'm looking at the doctor, and I said to the doctor, did you ask him? And they would say, no. And I'd say, well, you can ask him. He understands English. I said, they take out his hearing aid, so you might have to talk a little bit louder, but he can understand you. So the doctor looks at me, surprised, kind of shocked, and of course he's embarrassed. So that's just an example of a provider not letting their personal bias based on age and race affect their assumptions about the patient. The patient can always communicate better about what's wrong with them than anyone else. Next, treat me, number 4, with courtesy and respect. This example is a robot. Now the doctor is on the robot, but the robot in this case is in a hospital and the robot goes into the patient's room. It has some sort of technical issue, so the robot just goes over the threshold of the door to the room. And so it can't go all the way in and it has to stay near the door. Now, the patient is an elderly patient who's in bed and his adult daughter is in the room with him. So the robot starts talking and the patient can't hear because the robot's too far away. So the daughter listens and tells her father what the robot or the doctor on the robot is saying. So the problem though is that the robot with the video of the doctor is telling the patient that he isn't going to survive in the next couple of days to leave the hospital. So it's bad enough that the doctor is talking from a robot instead of doing this more sensitively and more respectfully in person. And what makes it worse is because the robot is too far away and the daughter is standing next to her father, telling her what the doctor and the robot is saying, she ends up telling her father that he's going to die in the next couple of days. So that's wrong, but it's also very sad that the hospital decided that, or the doctor decided that this was an appropriate way to treat the patient. So if this sounds fictitious to you, it's not. It really happened, and it was earlier this year. So number 5 on the list, treat me in a healthcare environment that's clean and comfortable. Number 6, give me confidence in your abilities. Tell me what's wrong with me. Explain what's wrong with me and how you decided that. Tell me how you're going to treat me. And then tell me what the plan for getting me better is. Give me the plan of care and give it to me in writing, and it should match what you told me. There are many times I've seen the written plan doesn't match what the doctor has said. Number 7, make it fast. Everything is on demand these days. People don't want to wait 2 weeks to get a doctor's appointment. On demand is how people shop. They shop online for all things, including vacations and healthcare. Time and place are irrelevant when you shop these days. Now, it's a little bit harder to shop for price and quality for the average consumer for healthcare. So they do the next best thing. They Google. 160 million Americans Google their symptoms every year. They can read a variety of websites in the responses from respected providers like the Mayo Clinic or the World Health Organization to websites that provide almost fiction. In some cases, they are fiction. But this shows that people prefer convenience more than scientific rigor. They can also use symptom checkers that are scientifically validated and can provide both convenient and reliable access to services, just like what they're used to in any other aspect of their life. So the problem with this self-diagnosis, it's fast and it's convenient, but people have a tendency to rule in more than they rule out what they might have. They also tend to look at the more serious illness that matches their symptoms. You know people like that. I know people like that. We all know people who are like this. So at the end of it, they still need to talk to a healthcare provider because now they've scared themselves to death. So some examples of providers of care that's billed as fast, convenient, and affordable. So next, number 8, convenient. So after they've self-diagnosed and they're calling their doctor to make an appointment, if they have a primary care doctor, but an appointment with a doctor could take 2 weeks. So they also have the option of going to an urgent care clinic or connecting on demand with for a virtual visit with a doctor or a provider. It really depends on how long the patient feels that he can wait. So the option of a virtual visit or urgent care is convenience. You don't have to leave home for virtual, and you probably don't need to drive more than 15 minutes to an urgent care clinic. Virtual care is also open 24/7 on demand, and urgent care is available evenings and weekends when doctors' offices are often closed. So number 9, make it affordable or inexpensive. Prices for urgent and on-demand care are listed so that the consumer can see what a visit's going to cost before they actually have the visit. Not all urgent and on-demand providers accept insurance, and for these, the consumer has to pay at the time of service, but they will provide the documentation that's needed to get reimbursed by the insurance plan. So in the end, for a consumer, going to a doctor's office may actually cost more after copays than going to an urgent care or on-demand virtual care visit. Now we're going into the in-depth experience expectations. The ultimate consumer experience has 5 expectations. And in this, it means that you're maximizing consumer friendliness, and together the providers and the patient create a great patient experience. So 5 ways to do this. Number 1, access via multiple channels. Access is the most important factor. Offer access in many ways. Don't limit it to telephone only or computer only. Customers are looking for providers on their mobile phones, their PCs, their apps. Telephone access alone limits the function to times when someone can answer the phone, or worse yet, they leave a voicemail and someone has to call them back, because then that puts you into telephone tag. So use all your channels that your customers use and that your potential customers use to improve access. That includes text, mobile, website, email, telephone. The only thing that you probably should forget about is fax. We're the only industry, healthcare is the only industry that keeps fax alive, but consumers don't use faxes. It will go the way of pagers and become extinct. Another access factor is the ability to schedule an appointment or procedure within a reasonable time period. Consumers want to be able to reach providers and schedule appointments for themselves online by picking times and dates that work for them. And they don't want somebody reading a list of times and dates that are available to them. They want to be able to look at them. And these days, most customers want to make appointments quickly and at any time of day, not just when you, the provider, are open. Number 2, personalize your interactions. It's a mistake to assume every interaction must be done with a person. For example, having a person to talk to make an appointment is not personalization that anyone cares about. One of my clients makes all their patients call on the telephone to make an appointment. They even have people walking in to make appointments because they have a problem with the phone system. They have too many calls and the phone system gets overloaded. So the calls might go to voicemail, the phone might just keep on ringing, or worst of all, is that it goes into Neverland as a lost call, and they don't know what happens to those calls. So their solution was to hire more people to answer the phone. Now that might work for a little while, but in the end, you can't use a 20th century solution in the 21st century when more advanced technology is available. Speed and convenience are more important. Use personalization when it matters. Another personalized interaction is to use virtual video visits. These are personal because the provider and patient can see each other visually. And the provider knows something about the patient because she is given answers about her history and conditions before the video visit takes place. And then one last way of personalization is a customized triage or symptom checker. These are more personal than a website or patient portal, unless the patient portal offers information about that individual patient. And in the future, artificial intelligence technology will be a way to keep things personal because they will know what a patient has, their condition, and they'll be able to make recommendations based on many other factors that are in the patient's electronic health record. Number 3, be deliberate in price transparency. There's been a lot of news about surprise bills for patients these days. One example is a woman who was treated in Washington in the emergency room for a heart problem. And then while she was being treated for that and recovering from that, she developed an infection in the hospital that kept her in the hospital for 2 more weeks. Her bill totaled over $450,000. And she, the patient, was billed the balance. They call this balance billing, $224,000 after the insurance paid. So she had to pay, or was at least billed for, almost 50% or half the bill. So neither the insurance company nor the hospital bothered to tell her that she could have transferred to an in-network hospital and then saved herself tens of thousands of dollars. Now, this became a public issue because the woman and her husband couldn't afford, obviously, to pay that $224,000. Next on transparency, EOBs are not transparent. They're neither explanations and they don't tell you about the benefits either. They're difficult to understand for nearly everyone and probably even the people who write them. So if a patient comes and asks questions about an EOB, be patient and help explain it to the extent that you can. Another under price transparency is helping the patient to understand payments. And when possible, discuss it in advance for planned treatments and find a way to make payments work for the patient. In some cases, organizations use a financial person to go over what the planned expenses would be, how much, an estimate of how much the insurance company would pay, and then an estimate of how much the patient would have to pay. So if you can do that, the consumer is less stressed and you, the provider, actually get paid. So an example in the dental industry, in dental insurance, I had to have gum treatments on two sides of my mouth. And the oral surgeon said to me, well, you can do it in one sitting or you can do it 2 times. It really depends on you and how long you want to not be able to eat very much. So while I'm thinking about it, the financial person came in and talked to me about the dental insurance, and she was going to tell me about how much I was going to have to pay. And she said, it's near the end of the year. It was like October or November. And, you know, the insurance company, dental insurance, pays a maximum amount every year. And they don't pay more than that. Everything beyond that, you're responsible for. So she said, you know, if you do one side now, and then you do the other side at the beginning of next year, then you will not have to pay very much this year and almost nothing next year, because the amount that dental insurance would pay out would cover most of the cost of the treatment. So things like that can be very helpful. And, you know, patients don't think about insurance and how insurance works. So that can be extremely helpful to patients and help them save money. Number 4, under the things that expect in-depth expectations, is actions. Actions mean more than words. Patients want to see actions that express empathy and compassion, not just people who say that we are empathetic and compassionate. They want providers to listen to them and act in ways that clearly demonstrate they care and that they understand. And number 5, wayfinders. For large facilities and even small facilities, make it easy for your customers to find the way around your facility. You need to have clear signage, information about where to go. You need to have convenient parking if at all possible. Some organizations are using digital assistants to help the consumer or the patient or visitor tell them where to go, and they can ask a digital assistant verbally, you know, where can I find radiology? And the digital assistant will respond by telling them where they can find the radiology department and how to get there. So consumers are expecting that healthcare has the same level of delivery as other industries. So beyond what the patient's expectations are, here are 5 ways to be their first choice. In order to be your customer's first choice, you need to treat your patients like customers. The consumerization of healthcare puts power into the hands of the consumer. So number 1, be distinctive. You don't have to be unique, but you need to be distinctive. Virtual care helps you become distinctive. And if you start now, you will be ahead of others and you will be competitive. Consumers are ready to try virtual healthcare, And their top reasons for using virtual health are convenience, it's consistent with their lifestyle, and they're curious. Number 2, be best in class. Know who your customers are or who you want them to be. Then make yourself appealing to them in order to attract them. Another example of best in class has to do with employers. Employers like Walmart are sending patients to specific hospitals called Centers of Excellence in the United States. And they're doing this so that patients can receive more accurate diagnoses and the proper care. So they end up saving money, and they send these people to these different hospitals, but they don't have to go. They have a choice. If they go to these hospitals on the Centers of Excellence list, then Walmart pays for their travel and the entire cost of care. If they don't, then they have to pay, then Walmart pays only half. So these are self-selected, but when they compared the results, they found that those who went to the Centers of Excellence ended up with shorter hospital stays, they had lower readmission rates, and they had fewer post-surgical needs. And patients were able to return to work 3 weeks sooner than those who did not go to the Centers of Excellence. So their Centers of Excellence for Care has expanded to, it went from just spine pain to cancer and joint replacements and heart surgeries. And now Walmart has just added imaging centers to get the highest level of diagnostic accuracy for their employees. Because what they found was that the high error rates in diagnostic imaging was causing misdiagnoses, which led to unnecessary surgeries and just wasted expenses. So being best in class, also make yourself first choice, is to keep technology in the background. Use it in the foreground when it's appropriate and assist the flow of care. Number 4, let the patient control their own health information. A good example of this is Apple Health Records. What they've done is to contract with hospitals and clinics and even physician practices for a format where the electronic health record can be downloaded by the patient to their own personal device, be that a phone, a tablet, or personal computer. But it gives the patient all of their electronic health records, which they can then provide to any provider that they want to share it with without having to go through all the HIPAA paperwork. So control of their own health information is important. Number 5, show that you care. You need to step up your service. Ever wonder why the patients go to Minute Clinics? Yeah, convenience is one of the reasons, but it's really more than that. And this is something that providers can easily follow. They go to CVS, and you can go and take a look yourself. Go to their website. It's very friendly. Their site says they think of the customer as family. This is pulled from their website. We treat you like family. And it gives the impression of high quality, in addition to telling the potential patient what they treat and how much each of those treatments will cost. Now, maybe you can't do it for all of the things that you treat because you treat more than what CVS does, but you can. There's a starting point. The other thing that they do is that they tell you that they will treat you on your schedule. You can schedule an appointment on demand. In other words, go to the website or go to their app and schedule an appointment. If you need to change the appointment, you can change the appointment online. You don't have to talk to anybody. And on top of it all, you can wait at home instead of the doctor's office where there are a bunch of sick people before your appointment. The other thing they offer are virtual video visits. These virtual visits are available 24 hours a day, 7 days a week, and they cost $59. So people go to CVS because they offer high quality, convenience, and services at a reasonable cost. And they expect them to be consistent, like a Starbucks. They offer the same things across the nation. They offer the same prices across the nation. So they are consistent. Number 6, pay attention to the patient experience. What do patients do when they have a positive or negative experience? So research shows that if they have a positive experience, they will use the same provider or organization again. 73% of the patients said that they would do that. The patient experience influences customer loyalty and patient choice. Now, out of those with a positive experience, 70% said that they would also share their experience with others. Now, after a negative experience, 76% said that they would tell others about their negative experience. So the takeaway from this is that 7 out of 10 encounters, people will share their experience with others, negative or positive, and those people will share it with other people, and so on. Those people will share it with others. So the good thing is that is how loyalty can be developed. So I want to leave you with the thought that consumers have choices. Show them that you care and that you want to make healthcare easy to access. You want to make it convenient, and of course it will be high quality. In return, you will be rewarded with happy, loyal patients. Thank you. Please join me for Injecting Innovation, our final webcast of this series on Tuesday, June 11th at 12 noon Pacific. If you have any questions, please feel free to contact me via email or phone.